Heart attacks, or myocardial infarctions, are among the leading causes of death globally, and their onset can often be sudden and devastating. For those who are young, seemingly healthy, and unaware of their susceptibility, the loss of a loved one to such a condition can feel shocking, as in the case described by Teach Oh, a 36-year-old from Hanoi. It is easy to assume that heart attacks primarily affect older individuals, but this misconception can prove dangerous. In reality, a heart attack can strike anyone, regardless of age, and the underlying causes are often more complex than simply advancing years. For those unaware of their increased risks, the consequences can be severe, and the loss of a life, especially in those seemingly at low risk, is a stark reminder of the hidden dangers that many fail to recognize until it's too late. Heart attacks occur when the blood flow to the heart muscle is abruptly cut off, typically due to a blockage in one or more coronary arteries. These blockages are often the result of a buildup of fatty deposits, cholesterol, and cellular waste materials, or they can arise from a sudden blood clot forming at the site of a pre-existing blockage. The damage caused by this interruption in blood flow can be extensive, and often, it is irreversible. While it is common to associate heart attacks with older individuals or those with a history of cardiovascular disease, they can also affect people who appear outwardly healthy and fit. The risk factors for heart attacks are numerous and often insidious. Age is one of the most significant factors. While it's true that the risk increases with age, the timeline can vary greatly depending on lifestyle choices and genetic predisposition. For instance, men over the age of 45 and women over the age of 55, particularly those who have gone through menopause, are at a greater risk, but that doesn't mean younger people are immune. The unfortunate reality is that many people who are young and feel healthy do not fully appreciate their vulnerability until they are faced with a sudden, life-altering event. Family history is another crucial factor that cannot be ignored. If there is a history of heart disease in one's family, such as a parent, sibling, or close relative having suffered from a heart attack, your own risk is significantly higher, even if you lead an active, healthy lifestyle. This genetic predisposition can be the silent threat that many fail to recognize. Those with a family history should be especially vigilant in monitoring their health, as their genetic makeup can increase the likelihood of developing similar conditions. Other well-known risk factors, such as smoking, high blood pressure, high cholesterol, and diabetes, are even more alarming because they are often preventable. Smoking alone is one of the most detrimental habits, causing severe damage to blood vessels and significantly increasing the likelihood of blood clots. High blood pressure puts additional strain on the arteries, accelerating the process of plaque buildup and increasing the risk of a heart attack. Likewise, high levels of LDL cholesterol, often referred to as bad cholesterol, contribute to the thickening of artery walls, while diabetes accelerates damage to blood vessels, raising the risk of heart disease even further. Being overweight or obese is another factor that cannot be overlooked. Excess weight, particularly around the abdomen, contributes to a number of health issues, including high blood pressure, high cholesterol, and diabetes, each of which is a major risk factor for heart attacks. The widespread problem of obesity, especially in younger populations, has become a silent epidemic that is leading many down a path to heart disease without them even realizing the damage being done. This is compounded by a sedentary lifestyle, which is unfortunately all too common in today's society. Lack of exercise, poor diet, and prolonged periods of inactivity increase the chances of developing heart disease significantly. Chronic stress, a growing issue in our fast-paced world, is yet another contributing factor. The effects of long-term stress on the body can be devastating, contributing to elevated blood pressure and increased levels of cortisol, which in turn strain the heart. Those who do not take steps to manage their stress may find themselves at a higher risk of heart disease, especially if combined with other risk factors like poor diet and lack of exercise. Stress can also lead to unhealthy coping mechanisms, such as overeating, smoking, or excessive drinking, all of which exacerbate the risk of a heart attack. The role of alcohol and drug abuse, including the misuse of substances like cocaine, cannot be underestimated either. Excessive alcohol consumption and drug use cause severe damage to the heart and blood vessels, making them key contributors to heart disease. Many people who abuse alcohol or drugs may not immediately associate their behaviors with heart problems, but the damage accumulates over time, silently increasing the risk of a heart attack or stroke. For younger individuals, it's easy to feel invincible, assuming that heart attacks are something that happens to others, especially older people. However, as demonstrated in the case of Teach O's loved one, this is a dangerous misconception. Men tend to be at higher risk of heart attacks at younger ages, but after menopause, women's risks increase significantly, often surpassing those of men. Hormonal changes, combined with other lifestyle factors, contribute to this increased vulnerability, making it crucial for both men and women to recognize that heart disease can strike at any age. The reality is that heart attacks are often preventable, but they are insidious, slowly developing over time until they strike with little warning. Understanding the risk factors and taking proactive steps to manage them is essential to reducing the likelihood of suffering from a heart attack. Regular checkups, maintaining a healthy weight, exercising, managing stress, and avoiding smoking and excessive alcohol use are key to safeguarding one's health. Ignoring these factors is a dangerous gamble, one that could lead to a devastating, life-altering event. While the statistics often focus on older individuals, the truth is that heart attacks can strike anyone at any time, and the cost of complacency is far too high.